Good afternoon. I'm Angie Murad. I'm a patient educator with the Stephen and Barbara Slaggie Mayo Clinic Cancer Education Program, and I'll be moderating this session today. So this is our fourth session of our six-part series on survivorship. And this one is Tools for Wellness, Physical Activity. So we want people to know on this session that we are recording it so that individuals who are not able to join us for this live session can watch it later. And for those of you that are here live, you can watch the recording. I will put it on Mayo Clinic Connect. Allow for about 3 business days for us to put it onto Connect, our digital platform, and our video library tab. So Mayo Clinic Connect is a digital platform where patients, family members, and caregivers can connect with one another and get evidence-based information and get access to our classes and webinars that our center offers. So we encourage you to follow our cancer education blog on Mayo Clinic Connect so you can stay up to date on our education opportunities. And as soon as we get started, I will put the link to the cancer education blog so that you can follow that. So then I'd like to make a quick announcement about other webinars that will be coming soon. The next will be the first Wednesday of next month on November 2nd. We had a slight change in the name, but it's the same information that we'll be presenting, and it's on managing cancer-related fatigue. So again, Wednesday, November 2nd at 1 o'clock. And again, we will also record that session too. So if you're not able to join it, we will have that available on our video library tab. So we'll take questions at the end of the session. If you have questions related to this particular webinar, please put them in the chat at the bottom of the screen. And I will read off those questions. And right now I will turn it over to Terra Register, who's one of our very own patient educators.
Thank you, Angie. Like Angie said, I am a patient educator and my name is Terra. I will be going through the session about tools for wellness and physical activity. So I just wanted to do a disclaimer here that the information in this webinar is not intended or implied to be a substitute for personal medical advice, diagnosis, or treatment. Please just always work with your physician or a qualified healthcare provider when you're considering any adjustments or medication, supplements, or any lifestyle changes, including anything detailed in this webinar. Please note that the science update contents of this presentation may change. So I will go ahead and get started. So I would like to begin with that definition again of a cancer survivor. Not everyone who has or has had cancer uses or identifies with the word survivor, but for some people, this term may not feel just right. So they may feel more comfort defining themselves as a person who has had cancer, a person living with cancer, or another way. The term cancer survivor identifies a community of people with a history of cancer, either at the time of diagnosis, during or after treatment. The effects of cancer do not end when treatment ends. People with cancer or have had cancer are living longer due to the improved care and screening and newer treatments. It's important to be able to explain and discuss your medical and emotional needs with your healthcare team and loved ones. That's why people should always find words they are comfortable with to name and navigate their personal changes and challenges that have come from their cancer diagnosis and treatment. In this webinar series, we're using the term cancer survivor to identify someone who has recently completed treatment. It doesn't mean that the information provided in this webinar and our other webinars within the series will not be helpful, but some of the content may be more applicable to people during this phase of their cancer journey. The Mayo Clinic Comprehensive Cancer Center is a National Cancer Institute designated 3-site center dedicated to improving the lives of cancer patients and the community. Staff of the Stephen and Barbara Slaggie Family Cancer Education Center, located in Rochester, Minnesota, are committed to providing up-to-date education and resources to empower cancer survivors to be active partners in their health journey and beyond treatment. Mayo Clinic Connect is a digital platform where patients, family members, and caregivers can connect, get evidence-based information, and get access to information about classes and webinars our center offers. We encourage you to follow the cancer education blog on Mayo Clinic Connect so you can stay up to date on educational opportunities. We will put the link in the Mayo Clinic Connect cancer education blog in the chat. And you don't have to be a Mayo Clinic patient to follow and connect with others. This is our survivorship series. And again, this is session 4, tools for wellness for physical activity. Next month will be the managing cancer-related fatigue. And then lastly, we'll be putting it all together in December. So during this webinar, I just wanted to go through some of the learning objectives that we have here. And some of those could be like describing the benefits of physical activity, identify the various levels of physical activity, plan for those questions that maybe you should ask before performing any of those activities, identifying and mapping out those so you can start right away, and then plan for a safe, effective, and sustainable exercise plan. So physical activity. So most research on physical activity in people diagnosed with colorectal, breast, and prostate cancer, since these are among the most common. The American Institute for Cancer Research recommends that cancer survivors, when able, follow the same physical activity recommendation and other guidelines outline that 150 minutes per week at a moderate intensity or its equivalent is beneficial. After analysis, researchers found that the patients who met the minimum activity guidelines, both for before diagnosis and after treatment, had more than 50% reduced risk of recurrence and mortality compared to those not meeting the guidelines at either point. Studies have shown that regular physical activity can reduce anxiety and depression, improve your mood, boost your self-esteem, and reduce symptoms of fatigue, nausea, pain, and diarrhea. These benefits can be gained through moderate physical activity on most, if not all, days of the week. The U.S. Department of Health and Human Services, the American Cancer Society, and the American College of Sports Medicine provide the following recommendations for living a physically active life. So avoiding inactivity, really it's any kind of physical activity helps, even if it's not at a moderate or vigorous level. More studies are showing that being inactive increases the risk of some cancers. Being inactive or sedentary means you spend most of your time sitting without physical activity. Being regularly active. So each week, try to get at least 150 minutes of moderate activity or 75 minutes of vigorous activity. Try spreading these activities throughout the week. However, getting this much exercise over 1 to 2 days also helps. Include some strength training, lift weights, and do other muscle building exercise at least 2 days a week. Consider maybe some of those shorter sessions. If you don't have time or energy for long exercise sessions, go for shorter periods. The health benefits of several short 10-minute segments are similar to those of one longer exercise session. And then start slowly. If you are new to exercise, slowly increase the length and intensity of your physical activity. Keep ramping up until you reach 30 minutes of moderate to vigorous activity a day. So I want to explain those levels of activity that were mentioned from this previous slide. Activity is classified into types of exercise you perform and how hard you are working. Light activity, during light activity, you're not sitting, lying down, or standing still. You may not exert yourself, but you're not inactive. Examples would include washing the dishes, walking slowly, preparing food, and making the bed. Moderate activity, during this, your breath rate increases, but you can still talk without feeling out of breath. Walking is a great moderate activity. Other examples include ballroom dancing, canoeing, gardening. Vigorous activity, your heart beats faster and you breathe heavily and sweat. Often you are not able to talk as much. Vigorous activities include jogging, jumping, jumping rope and swimming. You can do these activities in various locations, could be outside in a park or at home. And then before starting any exercise regimen, you really want to have these things to consider. So if you've gotten chemotherapy to treat your cancer, you should talk to your provider about exercise. Each type of chemotherapy is different in how it affects your body. Some days your provider may ask you not to exercise because of maybe you have some lower blood counts or you're recuperating from that treatment. Or they may ask you to stay active, but reduce the intensity that you're exercising. Some side effects of that chemotherapy can affect your ability, would be anemia. It gives you that feeling of tiredness and shortness of breath. If you have a low platelet count, you may bruise more easily, leading to injury, tingling in your hands or feet that may affect your balance. Some effects from radiation therapy include sunburn. If you're outside exercising, take extra precautions to protect your skin as your increased risk of sunburns, dependent on the area of treatment with radiation. Other key factors to consider is other conditions you may have, including heart disease, diabetes, peripheral neuropathy, fatigue, and overall your bone health. Here at Mayo Clinic, your physician can refer you to clinics such as the cardio-oncology clinic or physical therapy for a more personalized plan when it comes to your cancer rehabilitation. These questions are extremely important to ask as you're getting started. Not every person is the same, so know what those things are that are specific to your individual needs to consider when you're starting with exercise. Consider these questions here that I have. What type of exercise or activity is safe or recommended for me? What types of exercise should I avoid? If I decide to use weights, how much weight should I use? How often do you recommend I exercise for? What's the duration per day or per week? Should I focus on one or more exercises? And what is my overall target activity level? So this is an action plan or a checklist of sorts of those items that maybe you should consider to start safely as an exercise or activity plan. So talk with your doctor about any of those long-lasting treatment side effects. Set clear goals. Exercise when your energy levels are high. Keep your routine flexible. Be patient with yourself because one day it could be you're feeling great and very energetic during a certain part of the day. The next, it could vary. Choose to walk. Walking is a great plan. And then check in with your doctor and ask for help when it's needed. Some useful tools. So to be realistic, specific, and start out small. Small changes have a bigger impact. Our goal is to provide knowledge and tools to help you set your own exercise-related experiments. Here are some common experiments. Think of activity as play. Do activities you enjoy. Include a friend to hold you accountable. Track activity in a journal and use an activity tracker. Finding the enjoyment in what you are doing. For example, if there's a certain thing that you like to do outside, whether it be duties or chores, some of those simple tasks. Those journals to help track your activity each day. This helps you keep you accountable as well as seeing your progress day versus day, week by week. This will help build up that confidence as you get stronger and displaying more endurance, your endurance rising. Activity trackers are items that you wear. These can help you track the amount of walking or exercise you do. Think of it more as a stopwatch of sorts. You can time your activity level, see your heart rate, count your steps. There are many different brands and types of these that you can buy to help you stay motivated and to keep track. These tools may help, but of course it depends on your preferences. Here are some suggested exercises to get you started. So relaxation breathing, this can help reduce stress and anxiety during your recovery. The goal is to breathe slow, deep breaths, creating an awareness of your breathing helps us relax and focus on renewing your energy levels. This technique involves inhaling for 5 seconds, filling up your chest, and then exhaling from your belly for 5 seconds, pressing your belly button towards your spine. During this time, you can use imagery to sense the tension and the stress leaving your body each time you exhale. Some balance exercises. These help reduce side effects of surgery and treatments, regain function and mobility, counter effects of muscle imbalance, and prevent future injuries from falls. Aerobic exercises. This is essential for good health and decrease fatigue. This may sound counterintuitive, but it does help by increasing the heart rate and that breathing. You don't need to exhaust yourself by any means, but being able to raise that heart rate little by little. Walking is one of the most popular exercises you can start with. It may not seem like much, but it is a gradual activity. Start with a few minutes, and each time you go for a walk, try walking farther or longer each time until you are able to walk 30 to 45 minutes a day. If this is unobtainable, then try 15-minute increments 2 to 3 times a day. Other activities that aerobic would include would be swimming, biking, hiking, or even dancing. Some stretching. Stretching is a good way to gradually improve your posture, your range of motion, flexibility. As we all get older, stretching is helpful to maintain that flexibility. This may be for a short amount at first. This is more so if you have received radiation therapy as a treatment for your cancer, especially if you experience some tightness in a certain area. As time goes, you'll see the benefits. Stretching exercises should be performed about 2 to 5 times a day, but consulting with your care team will help you understand your limitations and areas to focus. Some safe stretching includes warming up for 5 to 10 minutes, like marching in place or moving slowly with controlled movements. Avoid the bouncing motions. Slow stretches allows the muscles and tendons to lengthen and release without harm. Try to get the maximum amount of motion that does not cause pain. Hold that stretch until you feel tension, but not pain. This helps break down any scar tissue and restore mobility in the joints. Strength training. After range of motion is acceptable through stretching, then if okayed by your physician, you can begin to build that strength. This will help with balance and posture by way of restoring your core strength and improve your quality of life by making your enjoyed activities easier, protects you from injury, gives you an empowered feeling mentally and physically. On a side note, strength training is important for those that needed chemotherapy as a treatment. This is due to muscle to fat ratio that can actually have some weight gain associated. So more muscle building will increase your metabolism, which then can help you maintain a healthy weight. Other bonuses include stronger bones and decrease the risk for osteoporosis, which then could lead to weak and brittle bones. Activity can be split up. So walking 10 minutes 3 times a day or 15 minutes twice a day. Move more and just sit less. Aerobic is that walking, biking, jogging, swimming. The strength is the resistance bands, hand weights, body weight exercises. Flexibility would include like stretching and yoga. Even balancing is Tai Chi and yoga. Tips for safe stretching. So if you've gotten approval from your doctor to start these 2 activities, the goal is to get healthy, not hurt. So start slow. Do the exercises that are right for you at this particular time. Remember, even if you are physically active before cancer, you will need to slowly build up to your pre-cancer activity level. A good strengthening and stretching program can reduce stress, fatigue, depression, and anxiety, and increase those energy levels, your muscle mass, your flexibility, endurance, and your confidence. Consider these tips here. So your environment. So consider utilizing your home. Your immune system is probably still a bit altered after your treatments. So going to gyms might increase your risk for infection. So consider using your home as one of those base environments. Temperature controlled environments as well. So cold temperatures can crack your skin, and extreme heat can cause body swelling or lightheadedness and dehydration. Focus on balance. Poor balance may be caused by cancer treatment, weak muscles, neurological issues, or normal aging. In addition to common side effects of cancer treatment is the peripheral neuropathy, which changes the sensation in your legs, arms, maybe the toes and the fingertips. Protect yourself from falls. If you have balance issues or peripheral neuropathy, choose activities that lower your risk for falling. For example, avoid uneven surfaces, use a stationary bike instead of a treadmill without handles, wear comfortable clothing and appropriate footwear. For people with peripheral neuropathy, that affects the feet. Supportive footwear is really important. Do some warm-ups. Start with some deep breathing, then walk, march in place, ride that stationary bike again until your body feels warm. And remember to breathe. Don't hold your breath when you exercise. Take deep breaths and improve your workout and prevent lightheadedness. Drink that water, stay hydrated, especially when you sweat. And then move slowly and smoothly. Having good form is important. Never stretch or strengthen using jerky movements. Focus on the quality of your activity over quantity of your repetitions. Start your balance exercises routine with the following exercises. And you may want to hold a chair for support at the beginning. As you improve, you can try to hold the chair with maybe one hand and then eventually one finger. The goal to this is to eventually do these without holding the chair at all. Later on, after you've successfully done all these, for an added challenge, you can even try these exercises with your eyes closed. But please make sure that you are steady. Standing on one foot, hold for 10 seconds and then switch your legs. The tightrope, it's putting your heel in front of your toe of the other foot as if walking on a tightrope. Calf or heel raises. Stand in place and slowly raise each calf or your heel up and down. Front, back, and side leg lifts or raises. That would be standing in place, lifting your leg to the front, back, or side and rotating between each leg. Grapevines are side stepways while crossing one foot in front of the other. On the next step, cross the other foot in back of the other. Some other exercises to help improve your core strength would include maybe some of those pelvic tilts. You lay on your back with your knees bent and your feet flat on the floor. Inhale and fill your torso with air. Exhale while pressing your abdominals downward, bringing your navel to your spine. Lower and repeat for 5 to 10 repetitions. The bridge is lying on your back with your knees bent and your feet flat on the floor. Squeeze your glutes and lift your pelvis and ribs off the ground, leaving only your shoulders on the floor. Hold the bridge position for a few seconds, then lower and repeat. Complete that 5 to 10 repetitions. Aerobic exercise has many benefits, including improving your heart function, reducing your risk for heart disease and stroke, increases your energy, reduces feelings of anxiety and depression, and can help with sleep. Aerobic exercise involves any activity that raises your heart rate over a sustained period of time. Warming up is important. It reduces your body with a slow progression of increasing the heart rate, body temperature, and warming muscles to prevent any injury. Examples include walking slow for 5 to 10 minutes at an easy pace. Bike slowly for 5 to 10 minutes at an easy pace. What are some of the types again? They're walking, biking, gardening, jogging, dancing, jump rope, or swimming. Here are some tips for strength training. So you want to rotate those muscle groups. Don't overwork the same muscles in a single area. Focus on your form. When using weights, make sure you can do 10 repetitions in perfect form before increasing the weight. You should feel some fatigue by the 8th repetition. And then gradually do more. Increase the amount of weight you use in 1 pound increments. Being patient will help you achieve your goals without injury. Wait 48 hours between strength training sessions. Use the day between strength training sessions for aerobic exercise, stretching, and relaxation breathing. Make sure you do a cool down after strength training. Take a short walk or a stretch. A warm shower or bath can also help relax your muscles. And know your limits. Learn to tell the difference between muscle fatigue and unusual pain. Stop if you feel pain. If something doesn't feel right, don't do it. Talk with your doctor if you experience pain, swelling, or unusual fatigue. So starting a plan can be a large task, even if those of you who have not been through what you have, especially if you have other underlying health considerations. You need to start slow and build up as you're able. Talk with your provider about an exercise program. Find a partner, making each other accountable. Listen to music while you exercise, something that really gives you that motivation. Seek out an exercise specialist who has worked with patients with cancer. Add physical activity to your daily routine only as you feel able. Some suggestions would include, taking a walk after dinner, ride your bike, mow the grass or rake the leaves, scrub your bathroom, wash your car by hand, play games and activity with kids. They love that. Hide and seek, tag, jump rope. You could dance in your living room to your favorite music. Use your home as that exercise equipment. Use those resistance bands. Make that appointment with yourself to take 10 to 15-minute walking breaks. Maybe even get a fitness tracker. Cancer survivors may need to exercise less intensely and increase their workout at a slower rate than people who haven't had cancer. Remember that the goal is to be as active as possible, keep it safe, keep it fun, and make it work for you. And now I will go ahead and take any questions. I think Angie will go ahead and monitor the chat, and we'll go ahead from there.
Yeah, no, I was just checking the chat. No, great messages. I love making an appointment with yourself, being gentle with yourself, because I think often people really want to get back where they were possibly before treatment. And sometimes just depending on what they've undergone, you may need to just adjust that a little bit and work towards that new goal. So that's great. So remind me again to, someone else was asking about this, but I think it's a good point to stress. We often hear about that 150 minutes of activity to get in per week. Tell me again that is it okay to break that up and kind of going into that a little bit? Yeah.
Yeah, certainly. And, you really have to judge by what you can handle. It's a progressive thing. Nobody's going to expect you to start off with 150 minutes, right away. Start yourself off small. Just start with shorter goals. You could plan for maybe 30 minutes twice a week and, work up from there. Do as you tolerate. And, if you keep that journal, that's going to help you keep track of, what days you're feeling good and then the days that you do your activity. And then you can monitor the progress as you go.
Oh, good. The other thing too, someone was asking, you mentioned the different types of activities. If someone was not really very active in the beginning, you had listed quite a few different things to do, whether that's strength or cardio, and even the breathing activity. If someone hasn't been really active, where might they start, or how much should they do?
I would say that starting off slow, doing the breathing exercises and maybe some of the stretches, that's a great starting point. If you're not really physically mobile, you can do some of these sitting exercises, which will be included in some of those resources that we'll add. And it's more of a progressive kind of work through to demonstrate how you can do those exercises. And then once you're starting to feel a little bit more flexible, then you're able to progress into maybe more of these walking or, short little increments and build up from there.